اس چیز کی پھر 20 سال سے اس کی جو ہے وہ جرنی سٹارٹ ہوئی, لوگوں نے بات کرنا شروع کی, اور ویسٹ میں آبویسلی اس پہ زیادہ بات ہوئی ہے, لیکن یہ کہ پاکستان کے اندر الحمدللہ وی اسٹارٹڈ ٹاکنگ اباؤٹ اٹ ان اے فارمل وے اونلی 5 years ago, جب رفا یونیورسٹی, جس طرح رفا یونیورسٹی نے میڈیکل ایجوکیشن کے میں لیڈ لی ہے الحمدللہ, اسی طرح رفا یونیورسٹی نے پیشنٹ سیفٹی اور کوالٹی ہیلتھ کیئر کے اوپر بھی لیڈ لی, اور اس کے لیے 2 کام کیے. پہلا کام یہ تھا کہ ہم نے ایک پہلی کانفرنس آرگنائز کی, دا فرسٹ انٹرنیشنل کانفرنس آن پیشنٹ سیفٹی, اینڈ اگین دی آبجیکٹیو آف دا کانفرنس واز اے ٹو کریٹ اویئرنیس, second to educate clinicians, healthcare professionals, policy makers, government officials by bringing all of the stakeholders together, اور ہم ان کو بٹھا کے ہم نے 2 دن اسی طرح ایک کانفرنس کی, and we had speakers from all over the world جنہوں نے ہمیں بتایا کہ what is patient safety, what is preventable medical errors, یہ ہوتا کیا ہے, مسئلہ ہے کتنا بڑا. So alhamdulillah, that was the first initiative which Riphah University took. اس کے ساتھ ساتھ پھر آپ کو جان کر خوشی ہوگی کہ رفا یونیورسٹی نے ایک ادارہ قائم کیا, اور اس ادارے کا نام ہم نے رکھا رفا انسٹیٹیوٹ آف ہیلتھ کیئر امپروومنٹ اینڈ سیفٹی. دس از ناٹ اونلی دا فرسٹ انسٹیٹیوٹ آن پیشنٹ سیفٹی ان پاکستان, بٹ perhaps in the region as well. And we are focused, dedicated and committed to work in patient safety and quality health care, جس کے اندر ہم اپنے ہیلتھ کیئر پروفیشنلس کی کیپیسٹی بلڈ کرتے ہیں, ان کو ٹرین کر رہے ہیں, ان کے ورک شاپس کرتے ہیں, کورسز کر رہے ہیں. ہم نے رفا یونیورسٹی پاکستان میں پہلی یونیورسٹی بن گئی وچ ہیز انٹیگریٹڈ پیشنٹ سیفٹی ان دی انڈر گریڈ کریکولم الحمدللہ. سو پالیسی ڈاکیومنٹس ہم بنا رہے ہیں اس کے اوپر, اور ہم ریسرچ ہم اس پہ کرنا چاہتے ہیں. وی ہیو ریسرچ فرام دا ویسٹ, but we don't have local research and we don't have local data. تو ہم چاہتے ہیں کہ پاکستان میں ریلیونٹ ریسرچ کی جائے.
پہلے تو ہمدرد یونیورسٹی کا یونیفائڈ میڈیا کا بہت بہت شکریہ کہ مجھے ادھر انوائٹ کیا. So I'll be speaking in English and Urdu both so that we are on the same page. Just to start with, I would say that patient safety, the phenomenon of the patient safety should be very clear in your mind. Patient safety is about ensuring that the patient is receiving, according to the standards, what the international standards have defined about them. And mind you that patient safety is not just about an injection safety or a drug safety. It is about in a broader sense, it is much more than the medical safety. It is about the behaviors of the doctors. It is about the financial safety. It is about the risk posed to any individual inside the premises of a hospital. So the patient safety must be taken in that context as well. یہ ایک قدرت کا نظام ہے کہ ہر انسان کو موت بھی آنی ہے اور بیمار بھی ہونا ہے. سو ہم سب اس ڈیفینیشن کے اندر آتے ہیں کہ ہم سب ایک صحت مند انسان, بٹ وی ہیو بین, ہم پیشنٹ کسی نہ کسی اسٹیج میں رہ چکے ہوں. ڈاکٹر ذکی نے بڑی خوبصورتی سے کہا کہ جب یہ کسی ہاسپٹل گئے تو ان کو احساس ہوا کہ کتنا لاچار ہوتا ہے. دس از ویری رائٹ. میں ایز اے ڈائریکٹر جنرل میں اپنی مدر کو 1-2 ہاسپٹلس میں لے گیا ہوں, شی از اولڈ, تو مجھے احساس ہوا کہ آپ کتنے ڈپینڈنٹ ہوتے ہیں اس سیٹ اپ پہ, ڈاکٹر پہ, ایم ایس پہ. اور مزاجن میں ذرا بہت سینسٹیو ہوں میں, ادروائز بھی جب میں ہاؤس جاب کر رہا تھا تو اگر کوئی مریض سیریس ہوتا تھا تو اس وقت جس نرسنگ اسٹاف کی رات کو ڈیوٹی ہوتی تھی, بس ان کو یہی ہوتا تھا کہ جی اب اللہ خیر کرے, کیونکہ ڈاکٹر صاحب نے ہمیں نہیں چھوڑنا اگر اس مریض کو کچھ ہوا. سو یہ ایٹیٹیوڈ کی بات ہے, یہ جو میں آپ کو بات بتانے کی کوشش کر رہا ہوں یہ ایٹیٹیوڈ کی بات ہے. اچھا, اس میں کچھ اور چیزیں ہیں جو میں آپ کو بتانا چاہتا ہوں. پیشنٹ سیفٹی میں سب سے پہلے ٹاپ پہ آتا ہے لاس, پھر رولز اینڈ ریگولیشنز اور پروسیجرز, پھر جو سب سے زیادہ اہم چیز ہے وہ ہے پریکٹس. پاکستان ایک ایسا ملک ہے, میں کچھ جنرل باتیں بھی کروں گا آپ سے, पाकिस्तान एक ऐसा मुल्क है जहां भरमार है कानूनों की, हम प्रैक्टिस क्या करते हैं? इशू ये है कि हमारे पास लॉज भी हैं, कानून हैं, रूल्स हैं, रेगुलेशंस बनी हैं, पूरी पूरी किताबें हैं, लेकिन व्हाट इज योर प्रैक्टिस? इसका जवाब मेरे पास तो है कि हमारी एक प्रैक्टिस मैल प्रैक्टिस में किस तरह कन्वर्ट होती है और वो कंटिन्यू किस तरह रहती है। और ये सिर्फ पेशेंट सेफ्टी पे लागू नहीं है, आप अपनी ट्रैफिक को देखें। जिस दिन ये कानून आया कि सीट बेल्ट के बगैर इस शहर में किसी को देखा जाएगा तो पुलिस ऑफिसर जो स्ट्रीट पे खड़ा हुआ है उसको 500 रुपए जुर्माना करने की पावर्स होंगी, आप यकीन करें कि 99.9% लोग सीट बेल्ट पहन के चलते हैं। इसे ऐसी बात है। अच्छा, अब मैं थोड़ा सा आऊँगा, डॉक्टर ज़की ने बहुत ही खूबसूरत तरीके से समराइज किया चीज़ों को। मैं थोड़ा सा ऐड करना चाहूँगा उसमें कि 400,000 लोग सिर्फ यूएस में एरर्स, मेडिकल एरर्स का होते हैं। आप इमेजिन करें कि जहाँ रिकॉर्ड कीपिंग नहीं है, जो डेवलपिंग कंट्रीज हैं, वहाँ कितने ज़्यादा लोग जो हैं वो इस मेडिकल एरर का शिकार होते होंगे। सो बुनियादी चीज़ कानून के बाद रिकॉर्ड, उसका डेटा की कलेक्शन है, और डेटा की कलेक्शन के लिए सिस्टम्स तो ज़रूरी हैं, लेकिन ये शऊर भी ज़रूरी है कि आपने रिपोर्ट करना है।
I mean, I think this is an incredibly important subject, and I mean, I think Dr. Zaki has made that clear. I mean, the reason why it's important because it matters to all of us, and no healthcare professional wants to do harm to patients. I think when we do accidentally do harm, and we all do that harm, we live with that as a professional, the consequences of that. And I mean, if you carry that kind of weight throughout your professional career, it's really problematic. So there is this notion of the second victim being the healthcare professional. I want to make a couple of points really, and the first is that so Dr. Zaki referred to the Institute of Medicine and its two landmark reports, To Err is Human and Crossing the Quality Chasm. I had the privilege of hosting the president of that organisation in Edinburgh earlier this week. It's now called the National Academy of Medicine, if you're going to look it up. A really important organisation. And recently it's also published in a follow-on report looking at this issue in a global context. How can we improve the quality of care globally? And so that may be one that you want to have a look at. But in the UK, we had a similar report. It was called An Organisation with a Memory, produced by our Chief Medical Officer for England at the time, Sir Liam Donaldson. And I think one of the kind of take-home positions there is that these kind of statements of intent coming right from the top of the organisation are really important in sending the kind of charting the direction of travel. And so, I mean, I think the question is there going to be something similar, a pronouncement right from the top of those responsible for healthcare in Pakistan, that it says that we are serious about it, that there's going to be commitment behind this, that resources will follow, and if that can happen, then I think there will be benefits, I'm sure of that. I think the second thing I wanted to make was that we're all struggling with, this issue of open disclosure. I think in the UK we are doing better. I mean, it's improving gradually. So, for example, when our clinicians have their annual appraisals, as we do now, what we're required to do is talk about things that have gone wrong. Do that in a proactive way and share our learning from that. We have a national database of medical errors in the UK. That has now something like 15 million entries in it. It's the largest database of its kind in the world. The key thing is that we extract learning from that and we try and reduce the risk of those same errors occurring again. So is there something similar on the cards for Pakistan, for example, where people are proactively, they're encouraged, they're actually penalised if they do not report errors? So can we change that dynamic in a serious way? I think the third thing I want to say is that Pakistan, like every other country in the world, is making, I think, considerable progress with universal health coverage. It's signed up to the Sustainable Development Goals. So in our country, where Enrique and I practice, 95% of the care is in primary care context. That is the direction of travel really for the whole world. I mean, hospitals will not become completely irrelevant, but they need to become far less important in the equation. And so as you roll out universal health coverage, can you do that in a way that is safe, that is equitable, that is genuinely patient-centric? And so there's a phenomenal opportunity there, I think, to actually align these major issues. I think the last thing I wanted to say is that, possibly, I mean, there's actually so much to be said, but I mean, you need to be given a chance to kind of ask your questions, is that, I mean, I think from a media perspective, there are just so many stories potentially here. Some really, really interesting stories that, for example, about shining a light on what's going well in Pakistan, looking at what's happening, going well internationally, and seeing where there are transferable lessons, thinking about the kind of human consequences about this, the professional consequences, where initiatives are being taken, how they are faring. So actually, I mean, I think there should be no shortage of stories here at all, potentially. And I think if people want to make their careers, there are journalists in other parts of the world, and this is their kind of raison d'etre now. This is their main focus of activity. So I think, I mean, for those of you who want to focus on this in your career and you want to do it in responsible ways, there are absolutely phenomenal opportunities. Maybe I'll just pause there.
Tomorrow and the day after. As you said, and you've given such a wonderful summary of what it's all about. In the UK, wherever we are, the patient is the main focus of what we do, and I'm a nurse, by the way, so I'm also grateful that you created such a multidisciplinary event tomorrow. But I think that every healthcare professional, when we go to work, we are focused on giving safe care, effective care, and compassionate care. And that should be the essence of what we do for our patients. And maybe that's a nice story that media can make sure that patients know that what we want to do is provide that safe, effective, and compassionate care. That links really well with this universal view of healthcare. But of course, as you said, Dr. Zaki, sometimes things go wrong, and humans will make mistakes because we are human. But it may be less acceptable that organizations make mistakes and they don't learn from them. So we may be really happy to make mistakes as humans, but we may need to be sure that organizations are learning organizations and that they aim not to make mistakes. And of course, it's not just about education and training, but also about behaviors and values. And it may be that the other message that's essential for media to transmit to society is that the values that the organizations, healthcare organizations have got, are focused on quality and making sure that no one gets harmed. There are many things that we do in antibiotic use and infection prevention and control, and again, we provide education courses and training and at all levels, multidisciplinary level, but also we focus on leadership. So we consider every healthcare worker and every stakeholder a leader in patient safety. So you are media stakeholders in this process, so you are also leaders that need to think about what is my role, how can I improve, how can I make this process better, safer, and more humane? And that's maybe the biggest focus that we've had over the last few years, that every stakeholder is a leader. We've got important, well-trained professionals such as doctors and nurses and pharmacists. Patients are also leaders, but also politicians and policymakers are leaders in patient safety, and media as well. So I think that may be a nice take-home message. Think about your role and think about what you can do to increase the safety and improve what's happening in hospitals and clinics across Pakistan. And of course, I cannot forget but suggesting that there is so much fantastic work going on in Pakistan that also needs to be communicated by the media to the society, and maybe not just focus on when things don't go as well as we would want, because there is fantastic work and it's such a privilege to be here to learn from all the patient safety leaders that you have got here. So I'm really grateful in that sense.